Struggling with the body paragraphs in your OET letter? In this video, I'll show you how to structure and write them clearly and effectively. Let's make OET writing easier. Body paragraphs play a key role in your OET letter. They present the main clinical information in a clear and organized way. Each paragraph should follow a logical sequence, starting with the most relevant details and moving to the less critical ones. Most importantly, the content should be tailored to the reader's needs, whether it's a specialist, a GP, or a caregiver, so they can easily understand what's required of them. A well-structured body paragraph in your OET letter makes your message clear and easy to follow. Start with a topic sentence that introduces the main idea, like the reason for referral or a key medical issue. Follow it up with supporting details taken from the case notes, keeping the information relevant and concise. Use a smooth link or transition to connect to the next idea or paragraph. A helpful tip: each paragraph should stick to one theme, such as medical history, current symptoms, or social background. This keeps your writing focused and organized. Organizing your ideas logically is key to writing clear and effective body paragraphs in your OET letter. Start by using chronological order where appropriate. Begin with the onset of symptoms, move to the diagnosis, and then explain the treatment and response. Group similar types of information together, such as medical history, current condition, and any relevant social or personal issues. This makes your letter easier to follow. Most importantly, always prioritize what matters most to the reader, whether it's a GP, specialist, or caregiver, so they get the exact information they need at the right time. Here's a great example of a well-written body paragraph in a nursing OET letter. Mr. Patel was admitted on the 3rd of April due to worsening shortness of breath and was diagnosed with pneumonia. He was commenced on IV antibiotics and oxygen therapy. His condition has improved steadily, and he is now ambulant with no oxygen support. This paragraph is clear, concise, and directly relevant to the reader. It presents the clinical events in logical order, uses simple language, and focuses only on one key issue, Mr. Patel's admission and recovery, making it easy to understand and act upon. This example shows how to write a clear and focused body paragraph in a referral letter from a doctor to a specialist. Ms. Thompson, a 45-year-old teacher, has been experiencing intermittent episodes of palpitations and dizziness over the past 2 weeks. An ECG conducted yesterday revealed atrial fibrillation. She has no prior cardiac history and her blood pressure and thyroid function tests are within normal limits. I am referring her for further cardiology assessment and management. It highlights the patient's current condition and the reason for referral using a formal and objective tone. The information is tailored to what a cardiologist needs to know, making it purposeful and professional. This discharge letter paragraph clearly summarizes the patient's hospital stay and outlines his ongoing care needs. Mr. Lang was admitted on the 10th of March due to a left hip fracture following a fall at home. He underwent surgical fixation on the 11th of March and received post-operative physiotherapy. He is now mobilizing with a walking frame and requires assistance with activities of daily living. He is being discharged today and will need home visits for wound care and mobility support. It's concise, informative, and directly relevant to the community nurse, helping them understand both what has been done and what support Mr. Lang will need moving forward. This transfer letter paragraph provides a clear snapshot of the patient's condition and care needs. Mrs. Kelly, an 87-year-old widow with moderate dementia, is being transferred to your facility following a 5-day admission for a urinary tract infection. She has recovered well but continues to require supervision with medications and personal hygiene. She is non-weight-bearing and uses a wheelchair. Her daughter is her primary contact and visits daily. It effectively outlines her current functional status and ongoing support requirements, giving the residential care staff the essential details they need to ensure a smooth transition and continued quality care. This letter to a caregiver is a great example of how to communicate clearly and compassionately with a family member. Your mother has shown good progress in managing her diabetes since her last admission. She is now independent with her insulin injections and has been following her dietary plan. However, she may need reminders to check her blood sugar levels twice a day and record them in the provided logbook. A follow-up appointment has been scheduled in 2 weeks. It highlights the patient's progress while gently guiding the caregiver on how to offer support at home, using a warm yet informative tone that's easy to understand. This paragraph is a clear and professional way to inform a GP about a patient's visit and the next steps. Mr. Singh was treated in our clinic today for a recurrence of eczema on both hands, likely triggered by recent occupational exposure to cleaning chemicals. He has been prescribed a topical corticosteroid and advised to use gloves during work. Please monitor his condition and consider referral to a dermatologist if symptoms persist. It concisely summarizes the treatment provided and outlines a simple follow-up plan, giving the GP all the relevant information needed for continued care. Using the right language in your OET writing makes your letter sound professional and easy to follow. Always aim for a formal, clinical tone that reflects the seriousness of a healthcare setting. Avoid repeating the same words or phrases. Variety keeps your writing clear and engaging. Use linking words like in addition, therefore, as a result, and currently to connect ideas smoothly and show logical flow. Don't hesitate to use passive voice where appropriate, such as, he was admitted or medication was prescribed, especially when the focus is on the patient rather than who performed the action. Before you start writing your OET letter, it's helpful to run through a quick checklist to stay on track. First, make sure you've grouped related case notes together. This helps your paragraph stay organized and focused. Check that all the information you include is relevant to the reader, whether it's a doctor, nurse, or caregiver. Keep your sentences clear and concise to make the letter easy to read. And finally, ensure each paragraph sticks to a single topic so your message flows logically and professionally from start to finish. Thanks for watching. Don't forget to like, share, and subscribe for more OET writing tips. See you in the next video.